Thank you, Mr. Chairman, and thank you for both convening this hearing in the spirit in which you did, a bipartisan effort to really promote life science innovation in this country, which leads to new ideas, new research, new products that not only save lives but create jobs in our own community. I'm going to also welcome Dr. Collins and Dr. Hamburg here. I have the great joy of having both NIH and FDA located in my state. And we have two outstanding leaders here who really every day in every way think about how they can advance the mission of these agencies, and I would like to thank them for what they do. I'd like to thank them for hanging in there because many of the impediments that are created are impediments that we create ourselves. Not only to try to find new ideas, but maybe we need to get back to some old-fashioned ideas of working together, like the chairman has said. Dr. Hamburg, I know that you're leaving the FDA, but I know you're going to continue to serve in many capacities, and they said you're the longest serving, I'm the longest serving, and here we are, each turning a new page. I'd also like to take this opportunity to thank the men and women who work at both of these agencies, NIH and FDA. You have to know that for my 28 years of service, and what will then ultimately be 30 years of service, is to wake up every day to think about how I can make the world a better place. And I have these two fabulous agencies where my job is to help you be you. And I cannot tell you the pride and enthusiasm and joy that that has brought me. So let me get to what I think are the three criteria for reform and then get to my questions. Number one, let's respect the mission of the agency and let's respect the men and women who work at the agency. I think respect goes a long way to improving morale. Morale goes a long way in increasing productivity. And I would hope the Congress of the United States would embrace the idea of respecting the men and women who work in our federal agencies and not treat them as cheap throwaway lines on talk shows. The second is adequate resources so that you can do the job and have the tools that you need. And then third, let's approach reform in a targeted way, as the chairman has indicated. Let's focus on specific problems and specific solutions. So I posit that to my members here to think about the three R's: respect, resources, and reform that's targeted. Which then goes to my question, Dr. Collins, and you, Dr. Hamburg. Senator Murray raised the question of sequester. That then goes to predictability. Could you share with the committee the impact, because each one is, like Dr. Hamburg, in many of the reports, they say there's been a big turnover at FDA. Whether that's numerically justified, I'm not sure. So many accusations aren't justified. But could you share with us what that means in terms of the predictability, sustainability, as well as the adequacy? We know that you need more. I tried to lift the caps and so on. But what would predictability and certainty mean at FDA?
Well, certainly predictability and certainty is key. We hear it from the industries that we regulate in terms of how we oversee them, and it's essential to us to be able to do our job. We need to be able to lay out programs that are not occurring in one-year timeframes, but over time we need to be able to recruit the best and the brightest scientists and other professionals that we can that are highly competitive outside of FDA. So they need to know that they're going to be working in an environment where they're going to get the resources that they need and the support that they need in a continuing way. We certainly need every dollar that we get. As was noted, we have a very broad span of roles and responsibilities overseeing products that matter greatly to every American every single day, and we are stretched very thin. So uncertainty and instability in our funding programs make it harder for us
to recruit and retain.
Makes it harder to recruit and retain and to make wise choices.
Right. The other, then, with the predictability, well, what about you, Dr. Collins?
Well, I appreciate the question, and Senator, your strong support has been incredibly valuable, and we are all grieving the fact that you're planning to move away in 2 years, and we hope that this can be an opportunity for lots more conversation and effort in the meanwhile. I think the idea of stability is just crucial for biomedical researchers, especially for those who are early in their careers. They have visionary ideas. They're fearless about taking on problems that maybe couldn't have been approached before because the technology now makes it possible. But when they're uncertain about whether there's going to be long-term support for that, it's very discouraging. Another graph I'll show you is what it mostly troubles, I think, today investigators is what's happened to your likelihood of getting supported by NIH over the course of the last 50 years, which traditionally has run around 30% was your chance. It's below 20% now. It's running about 16 or 17%. That means 5 chances out of 6, your idea is going to get a no. And that means your science is left on the table unattended. That is enormously discouraging. If we could turn that corner, and the president's budget has, as you can see, that little uptick there, aimed to try to do that, we could turn this whole circumstance around in the United States. We could regain the kind of momentum and leadership that we've had unquestioned over the past many decades. But it is at risk if we can't do that.
So one is adequacy. I know my time is up, but I just bring to my committee 2 things. During the sequester, FDA couldn't use the user fees that the private sector was paying in for them to hire. So here's the private sector given the money after arduous work to create a contemporary PDUFA. That was one. And the very day before sequester, they announced that they had lowered cancer rates in this country 12%. So instead of pinning medals on people, we were getting ready to print pink slips. I think that's not the right way to govern.